Thanks for being here in Fairdale, in the heart of District 13. I'm Vicki Aubrey Welch, Councilwoman. Stretches from Valley Station, Fairdale, Auburndale, Yorktown, Okolona, and Hillview. So I have a pretty huge district with our illustrious 6,700-acre Jefferson Memorial Forest. And while you're here today, I hope you will spend a little money in our little district. Go have some pizza across the street. Go next door to the coffee shop. Get some coffee. She has teas, coffees, whatever you want to drink there on a nice, cool, sort of rainy day today. But it's wonderful to be here. I don't know, many of you probably know I was a registered nurse for 34 years. I've been involved with the health department ever since I've been on Metro Council. So I'm very pleased that they chose here to present this health equity report today, since I have been involved in a lot of the health issues of our community. And I think our star policy making that we've done was the smoking ban. And I think you're going to see that people are healthier because of that smoking ban. Ours is the most comprehensive in the whole United States, so it's wonderful. And it gives me great pleasure today to have all these great people with me, but first I want to introduce our wonderful Mayor, Greg Fisher.
Thank you, Councilwoman, and thank you for all of your tremendous leadership and our health initiatives here in our city. Obviously very, very important. I want to thank everybody for coming out here today. We see a lot of our great health leaders here in our community, so thank you all very much for everything that you've done to get this report to this point and helping to set the tone for our city as well. And what a great place to announce it here at the Fairdale Library, which is one of our centers for lifelong learning here in Southwest Louisville. If you have not been to the forest, you're not a Louisvillian. You got to check it out. You know, it is the largest urban forest in the United States of America, and it's just a real blessing for us here, so please check it out. I'm here today to join with our city's chief health strategist, Dr. Sarah Moyer, right here. Thank you, Dr. Moyer. Vincent James, who's our chief for community building and public health and wellness, reports into him as a chief. And then Dr. Brandy Kelly Pryor runs our Center for Health Equity. So this is a strong team that we have, and combined with you all, we'll take on any city in the world here with what we're doing here in population health. And so obviously what we're doing is releasing the 2017 Louisville Metro Health Equity Report. Becoming a healthier city is one of my primary goals and a goal of many of us, as we know. I've got three big values for the city: lifelong learning, compassion, and health. So we focus on it every day. The release of this report is a really critical step in the ongoing process of becoming a healthier city. As in previous years, the goal of the report is to prevent an unvarnished look at the state of health equity in our city. And part of all of our jobs is to celebrate all the good things that we've got going on. But you are not a good leader if you don't say, here's our gaps, here's our weaknesses, here's our points of opportunity, and then dive right into those. The report offers us all kinds of guideposts now. We've got information, insights, and perspectives for communities as we continue this work to make our city even healthier. Now, this report is coming out at a time when we know our economy is very healthy and very robust at the macro level, at the big picture level. In the last 6 years in our community, we've added 71,000 jobs. We've created 2,500 new businesses. Since 2014, we've got $11 billion of capital construction going on in our city. And about 10,000 people have worked their way into the middle class, out of poverty. So that's a lot of good indicators. Wages or income are up everywhere. 15 new hotels, 24 million tourist visits. Okay, we all got to be salespeople for the city. There's a lot of really good things going on. But the challenge for all of us is, how do we create that same level of momentum with population health so that everybody in our city can be enjoying the great momentum that we have in a healthy manner? Because our goal is obviously to make sure every citizen in every neighborhood is both safe and healthy. What this report underscores for us is to make Louisville a healthier city. We also have to become a more equitable city. Okay. Health and equity are deeply interconnected. We know that. That understanding is why our Center for Health Equity was created in 2006. We were the first country in the United States of America to create such a center. Since then, cities like Kansas City, New York City, and others have created their own health equity departments. Previous health equity reports released in 2011 and 2014 have shown us that health is obviously about a lot more than diet and exercise. Factors such as your income, your zip code, your race, your education level profoundly influence your health. And as a city and society, we have to understand that those are factors that we have to pay attention to and obstacles that we have to overcome. The 2007 Health Equity Report helps us better understand where we are as a city. It documents the link between factors like housing, food, education, the environment, and health across the lifespan of people all over our city. And it highlights the way that communities can work to become healthier and more equitable. This 167-page report, we might even call this a tome. I mean, look at this. I mean, it is rich with data and is the most comprehensive report that the Center for Health Equity has ever produced. It's beautifully designed, it's easy to read with the graphics in here, and obviously covers a wide amount of health issues from environmental health, Dr. Bhatnagar, issues like stroke, mental health, heart disease, diabetes, cancer, accidents, homicides, drug and alcohol use, etc. So the full range and full system of health issues in here. It's easy to read, easy to use. We're already getting requests from Centers for Health from all over the country to say, please get us your report as soon as possible. This has become a model for around the country. I want to congratulate and thank the entire team in our Public Health and Wellness Department. We have an extraordinary team of people doing very important work, super dedicated to what our city does and our citizens. These guys and gals are on the front line every day because, you know, health gives you an immediate opportunity to both respond in the near term, but then plan for the long term as well. And some of the work that we're doing in our city is leading the world with innovation, our Air Louisville project, our Green Heart project, the work that we did with our syringe exchange project as this scourge of heroin came upon this part of the country many years ago. So it's important that we take care of daily business, but we also innovate so we can have breakthroughs for health as well. I'm really proud of our Public Health Department for leading in that area. Dr. Moyer, good job to you and your team. When it comes to our Center for Health Equity here, Dr. Brandy Kelly Pryor and her staff have spent, it says months, but really over a year, developing this report and making sure that we want to get it right as we introduce it here today. So thanks to all the great folks at the Center for Health Equity as well. So let's hear it for them. Good job. Thank you. Now I'd like to ask Dr. Kelly Pryor, our leader, to offer us a few remarks. Doc?
Well, thank you so much, Mayor, and thank you for entrusting not only myself, but this entire staff with doing the very difficult work of health equity. And today is a celebration for us. We're very excited as a city that we can finally put it in all of you all's hands. Thank you, Councilwoman Welch, for just the moment that I entered was just such an advocate for the work in which we do in the Center for Health Equity and at Louisville Metro Public Health and Wellness. And then Dr. Moyer and Vincent James, you all have been phenomenal on this journey. So I would like to first and foremost thank these individuals behind me and thank all of you for being here today. This is, as I said, a celebratory moment for us that we get to put it in your hands, but also a very difficult moment for us to say we still have challenges and we need every single person in this room to come together and fix these challenges. And last but not least, there are 3 amazing people that stand in the center with me. That is Rebecca Hollenbach, T. Gonzalez, and Asia Barber. And they are amazing staff members that have helped to... Where are you all? Can you all please step forward so that we can at least see who you are? Oh, the people who do such great work always stay behind the scenes. So Thank you all so much. So the center and these three individuals, as well as myself, we stand on the shoulders of a legacy of a Center for Health Equity that has existed now for 11 years in our city. As you've heard, we were the first in the country to have a Center for Health Equity in a municipal government. And so we've been able to build on that legacy. We've been able to normalize this language of equity, not only here in Louisville and Jefferson County, but around the country and even the world, to say, what does health equity actually look like in practice? And how do citizens and departments and agencies come together to do the work of health that often is not considered health work, such as economic development and education and food systems and insecurities that we have around our community? So with that work, we know that bridging the community engagement and that divide that exists with big government data is so important. And so that is what we've done in the past 2 reports, and what we have done even more comprehensively in this report that will be in all of you all's hands right now. So you can log on to healthequityreport.com and see all of that intentional data, but I would like to just give you a brief overview for those of you who are present of what is in the report. It is set up into 4 different sections. The first section is really about the new methodology that we use in this report. Why do maps look different in this report than in the past reports in which you've seen in the past? In the second section of the report, we really go into who is Louisville Metro? Why do we have a history timeline? How does culture and history and the politics of our community, how does that shape our health? What are these artistic pieces of cultural production that we have that also influence the health of our community? So you'll see that in the report. And then in the third and fourth sections, we use the metaphor of the tree. And the tree is very critical for us laying out the root causes as well as the health outcomes that we see. You heard we have 21 health outcomes in the report that goes across the lifespan for individuals. So from infancy all the way to the end of life, and Alzheimer's, stroke, arthritis, some of those health outcomes that we see in our elderly population. What the tree metaphor does for us is connect these health outcomes, these 21 health outcomes that we talk about, and some of which we've talked about in past reports. These are in the leaves of the tree. We are really trying to get to what we call root causes. How did these health outcomes get to the way they are currently in our community? So there are 11 root causes that you will see throughout the report. These root causes include everything from food systems to criminal justice to economic development. And how does that influence these 21 health outcomes? What we know is critically important for the work of health equity and the work of equity in general is that how did these roots of our tree come to be planted? So thinking back to that metaphor, it's really about the soil. The soil of the tree is racial inequities in our community and sexism and all of the other isms that we might have. And so that is why we really want you to dig into the historical timeline and see how that connects to these root causes, which connect to our overall health outcomes. So, as you can imagine, we are all in this together. No matter what your sector or your agency is, you have something that you can do as it relates to changing the health in our community. In that, we also know, let's get into some of these health outcomes that we look at. Life expectancy in our community there is a gap. There is a gap from one part of our county to the other. With this gap comes cancer differences across the county. So you will see not only are we the highest in the nation for cancer, but we also have differences in where you live in our county and where you will see life expectancy as it relates to cancer outcomes. This is also similar to the beginning of life and infant mortality. And you will see those differences, particularly in certain parts of our county that have higher rates of infant mortality and higher rates depending on what your race or ethnicity might be as well. So we encourage you to really dig into the nuances of the report and look at that. But we don't want to just leave you there with what is the dire state of health in our community. We provide recommendations, and we know that our city, we're getting some things right. So as you heard, there are the comprehensive policies that we have just initiated as of August. That is going to, we know that is a best practice that is going to help our cancer rates in this city. So we're moving, and we will have a few years before we see some of these changes, but these are the types of things that in our recommendations, if we can just put policies into place, if our community agencies can come together, if our organizations can create coalitions like Healthy Babies Louisville, which is really dealing with our infant mortality rate in the city, if individuals can start to think about what is the one thing that I might be able to also do for my health, then we know that we will truly, truly make a change in Louisville. So what I would ask for all of you all is not only to log on and to see our report right now at healthequityreport.com, but to also let us know how you're using it. We get that question all of the time. How has the Health Equity Report changed the health of Louisville? As I've said, it takes all of us. We have to collaborate together to do this. So the only way that we know how this report is changing the health of Louisville is if you let us know. There are data request forms as well as speaking request forms for us to come and do more intentional deep dives into this data for you. But we'd also, if you're using it, write us a little email. Send us a little evaluation on what we could do better. If there are food systems maps that you would like to see more robust and how they relate to a particular health outcome, let us know that. And we are here to be of service to all of the residents in Louisville. We are following our mayor's lead in being transparent and an open government. And so we want to be able to help you, help us, and all of us build a better Louisville together. Thank you. Okay, so we'll take questions if needed.
Okay, I guess that's it. Any questions on the report?
If anyone just talk about how this information is then translated into policy decisions, how important is it and how's it done?
Oh, that's an extraordinarily important question, right? So how do we take this data then and turn it into policy? So the Center for Health Equity and Public Health Department works with our intergovernmental affairs work so that we identify which of these areas in the report makes sense for us to make a public change in process, ordinance, resolution, whatever it might be, so we can really affect important change. So an example of that would be going from the smoking ban that the councilwoman talked about earlier to extending that ban for e-cigarettes, for instance, which you've seen that type of change take place as well. So we take a look at each and every one of these to see what steps we can take. Doc, you want to add any thoughts to that?
Yeah, I think that's a great question. One of the other ways that we're looking at how it might influence policy, we are working on our Office of Addiction Services plan right now, and they are diving into the report to see what are some policies that have happened in other cities that we might be able to actually impact addiction. So not only what we have done, but how we'll be able to use this to influence some plans in the future.
Council will be voting on a 20-year plan for our built environment, which I believe your report shows is so important to health equity. Is it already planned to educate the council members so that they understand the entwining of the built environment with health outcomes?
So each council member will receive a report, a hard copy of the report for each of their offices. For each of you all, there will also be a report in every single library. So we're really excited to be here at Fairdale today because they will be getting their first copy of the Health Equity Report. So it will be a resource for all the community to be able to use and comprehensively dive into, be as accessible as possible. In terms of the comprehensive plan, you will see some changes in the maps, and the maps are also going to align with what is coming with the 20-year comprehensive plan. And so the hope is that we can make decisions based off of what is also in the Health Equity Report. So great question, thank you.
I'm looking at the life expectancy map and see that east side, longer life expectancy, northwest, as much as 10 years shorter. What does that tell you? And what steps can you take to address that situation?
So it tells us that health is a very complex conversation. It is not just a matter of individual behaviors. And so when we see population differences, one side of a community versus another having differences in life expectancies, we really need to ask, how did policies influence how those communities came to be? And what are those population differences within those communities, whether that be economic, educational, demographic, and otherwise. We do outline that in the report in terms of what those population demographics look like. And we also know that historically, issues of segregation and other housing policies have influenced why health has become that way on one side of our county versus another. So amazing question, and you will find more history in the report on that.
All right, thanks, everybody.